Welcome back. You know, most often when I tell people that I'm a psychoanalyst, they look at me very perplexed. There are three distinctly different types of mental health professionals with remarkably similar titles: psychoanalysts, psychologists, and psychiatrists. Of the three, only a psychiatrist is a medically trained physician. Their orientation and area of specialization involves the utilization of psychotropic medication for the management of the neurotransmitter-based issues related to human behavior. So that whether they're treating depression or anxiety or obsessive compulsive behaviors or attention deficit hyperactivity disorder or severe psychosis, they're always looking to manipulate and adjust the biochemical basis for these disturbances. We know from research over the past 20 years that there is a behavioral and emotional, cognitive, and very often a biochemical foundation. These issues are interrelated. We are biochemical electromagnetic beings. We put this into process, into corporeal being, but we are one and the same. When a psychiatrist functions as a consulting agent to a psychotherapist, I don't like that term either, but we'll use that, we refer to that psychiatrist as a psychopharmacologist. More and more, psychiatrists also provide psychotherapy, and in fact, increasingly, psychiatrists go on in their training and learn to become psychoanalysts as well. Psychologists, academically trained PhDs, originally began as a research component that has expanded, most especially with clinical psychologists who provide psychotherapy, various forms of psychotherapy, cognitive behavior modification, neurolinguistic programming, transactional analysis. Most importantly, psychologists are trained to conduct testing, emotional testing, cognitive testing, IQ tests, personality inventories. They are especially astute at developing diagnostic criteria and treatment planning. Psychoanalysts, who are trained either as a part of a medical foundation or an academic institution, or, in the case of my training, in a freestanding psychoanalytic institute, develop a broad-based theoretical conceptualization of the structure and development of the cognition and emotional basis of an individual. But more importantly, I think, their focus of attention, our focus of attention, is on the clinical aspect, the treatment aspects of helping someone to unravel the difficulties that they encounter and interact with them so as to change them through understanding. One of the unique characteristics of psychoanalysts, I believe, is that we do not look to define most of the world in terms of pathology. By pathology, I mean a problem, a difficulty, something to cure. Last time, I hinted at the repetition compulsion. And while we look at this as a neurotic development, a normal neurotic development, if you will, another way to look at the repetition compulsion is in terms of the desire for mastery. In reality, most of us want to get it right. And we try, and we try, and we try. The difficulty within the repetition compulsion, and perhaps this falls under a common definition of what crazy is, crazy with a small c, is that we attempt and we hope for a different outcome even though we are engaged in the same actions over and over again. So we do the same thing and we're looking for it to be different. We do the same thing and we look for it to be different. It can't be. What a psychoanalyst attempts to do is get into the person's developmental process, whether it be in the development of that short pattern and the outcome, of course with the deeper underlying aspects, or the development of their patterning, if you will, and attempt to create change early enough in the process so that the outcome will be different. One other concept I'd like us to hear about today just briefly is the notion of trauma. We hear a great deal about trauma. Post-traumatic stress disorder and trauma in general. It's a term that's tossed around. Trauma does not only occur when someone experiences something catastrophic. The essential definition of trauma is that the ego is overwhelmed by an experience and it disintegrates. It comes apart, much like a jigsaw puzzle might come apart and then gets put back together. The degree to which experience can produce this disintegration varies with the person's stability, but most importantly with their age, their developmental age. So that which might be traumatic to a 3-month-old is dramatically different from that which may be traumatic to a 50-year-old. An important concept within the arena of trauma is the repetitiveness of the trauma and the damage that that can create. If you take that jigsaw puzzle, each time you take it apart and put it back together, a little piece gets frayed. A little piece of us gets frayed. Eventually, if that happens enough times, you'll find that you might lose a piece. Depending on how we are traumatized through our lives and how many times we are traumatized through our lives, we either have these little glitches or we have holes. The holes, of course, are severe problems that take long-term treatment. I'll see you next time.